Coming up on Network Africa. Body of murdered Italian DRC ambassador returns home as Democratic Republic of Congo's president's office joins probe into Luca Antanasio's murder. One more Ebola case confirmed in the DRC as Guinea receives its 11,000 vaccine doses after being delayed by bad weather. Plus, Somalia reinvites leaders of Jubaland and Puntland for another meeting to deliberate on holding elections. Hello and welcome to the program. I'm Teniola Shoboale. The bodies of the Italian ambassador and his bodyguard killed in an attack in the Democratic Republic of Congo are on a plane to fly home to Italy. Meanwhile, a team from the Democratic Republic of Congo presidency will be deployed to Goma to support investigations into the assassination of the Italian ambassador. According to presidential press reports, the team will leave today and report regularly to the head of state. In a message published on Twitter, President Felix Tshisekedi says he is dismayed following the assassination of the Italian diplomat Luca Antanasio. The president also instructed the relevant services to shed light on this heinous crime as soon as possible so that perpetrators are identified and brought to justice. A Hutu rebel group known as the Democratic Forces for the Liberation of Rwanda, FDLR, has denied any role in Monday's killing of Italy's ambassador to the Democratic Republic of Congo. 43-year-old Luca Antanasio died in hospital after the United Nations convoy he was traveling in came under fire near the eastern town of Goma. An Italian military police officer traveling with the envoy and a Congolese driver were also killed. DR Congo's Interior Ministry accused the FDLR rebel group of being behind the attack, but the group's spokesman has denied the accusation. In a statement, the armed group says the attack happened in an area where both DR Congo and Rwanda have a military presence, so any investigation should take that into account. Let's get more on this story from a journalist in the DRC. Biobe Malenga is on ground in Goma, where he joins us. Thank you so much for joining us on Network Africa.
Thank you so much, Channel TV.
Well, let's begin with the mood in the country after the death of Ambassador Luca. And what are plans on sending the body home?
It's really sad news that has caused a great deal of fear for many people in this area, and even for tourists who visit Nyiragongo area.
Well, how does the government plan on investigating this murder? We know rebel group FDLR has denied responsibility after it was accused of the murder.
Firstly, the government, the Congolese government, has been insisting that the Italian ambassador has been killed by the Rwanda FDLR rebel. But even if themselves they are taking that, their news that the allegations are wrong and they are very far from the area of saying. But today, the President Felix Tshisekedi visited the family, the wife and the wife of the Italian ambassador, and say that he is continue to investigating about that. And from now, one of the delegation from Kinshasa was arrived in Goma to continue with investigation of that killings of the Italian ambassador.
All right, then a lot to keep our eyes on there. Biobe Malenga, journalist in the DRC, thank you so much for bringing us up to speed.
Thank you so much.
Meanwhile, the United Nations and the World Health Organization have condemned the attack on a UN convoy in the east of DR Congo that killed 3 people, including the Italian ambassador to the country. Ambassador Luca Antanasio, his bodyguard, and a national staff member of the World Food Programme were on a UN joint mission to one of the WFP program sites when they were attacked by armed assailants.
The Secretary General strongly condemned today's attack against a joint field mission of the World Food Programme in Kimbumba near Goma. The attack was perpetrated by unidentified armed combatants. The attack resulted in the killing of 3 people, including the Italian ambassador to the DRC, his bodyguard, and a WFP national staff member. The Secretary General expresses his deep condolences to the families of the deceased, as well as the government of Italy and the Democratic Republic of the Congo.
I'm deeply saddened and extremely concerned by the attack on a humanitarian convoy in the Democratic Republic of the Congo, which left 3 people dead, including the Italian ambassador to that country. I would like to express my deepest condolences to their families, as well as to the government and people of Italy.
Let's all get reactions from the ambassador's home country, Italy. Joining us now is Sabina Castelfranco, VOA correspondent in Rome. Thank you so much for joining us on Network Africa.
Hello, Teniola.
So what's
the mood here in this country is one of shock and outrage, really. And many are questioning, what kind of preparations security-wise were taken for this road trip from Goma. The fact is that he was traveling, the ambassador, with just one bodyguard, and also in a car that was not even bulletproof. So he had ordered a bulletproof car, but he was still waiting for this. Now, Ambassador Attanasio, he was one of the youngest diplomats who is an ambassador in the Italian Foreign Service, very, very well respected, a very capable person, known for a lot of his humanitarian projects. He leaves 3 children and a wife. And interestingly, he had also been ambassador to Nigeria, to Morocco, and previously in Switzerland.
Yeah, a really, really sad time for a lot of people. But what's the government's reaction following the murder of the ambassador?
Well, when incidents like this occur, there's always some sort of an investigation. And as you've said, there will be an investigation in the DRC. But the Italian authorities will carry out their own investigation. And in fact, that is normally carried out by the Rome Prosecutor's Office. And some officials have already been dispatched to Kinshasa for that investigation. And there's no doubt, obviously, that they will try to work as closely as possible with members of the government. And as you've said, Hutu rebels have already denied involvement in that ambush.
Well, Sabina, while we wait for the outcome of those investigations, is it possible this unfortunate incident could have an impact on Italy-DRC relations? And is there a reason why the Italian ambassador could have been targeted in this attack?
Well, unnamed sources have said that one of the possible motives for this attack and for targeting the Italian ambassador was for ransom money. However, this is really speculation at this early stage, and much will have to be revealed yet and investigated before there can be any certainties. Now, as far as relations between the DRC and Italy, I think initially there will not be a problem, that relations will continue as they have been until now. But of course, much will depend on what kind of collaboration there will be with the investigators that Italy has dispatched to Kinshasa in the very first stages and also down the line.
All right, then, Sabina Castelfranco, VOA correspondent, thank you so much for joining us on Network Africa. A lot to keep our eyes on there. To other stories, Somalia's presidency has invited the leaders of the semi-autonomous regions of Jubaland and Puntland for another meeting to deliberate on holding elections. The regional leaders on Sunday skipped a meeting hosted by the president, saying that they do not recognize President Mohamed Abdullahi Farmajo since his term has ended. The presidency did not give a date for the next meeting, but the opposition has accused the president of illegally holding on to power and called for demonstrations. Protesters clashed with security forces last Friday in the capital, Mogadishu. The president's term ended early this month before the federal and regional leaders could agree on when the elections should be held. To health matters now, the Democratic Republic of Congo has confirmed one more case of Ebola. The latest case is connected to the first case of the nurse who died in the country's resurgence of the virus. The country now has 7 confirmed cases and 4 deaths, and that's according to the World Health Organization. The country launched a vaccination campaign 7 days after the resurgence, and over 250 health workers and high-risk contacts have been vaccinated. In the meantime, a special plane carrying a consignment of Ebola vaccine has landed in Guinea. A dust storm in the Sahara on Sunday forced the aircraft off course and diverted it to Senegal, delaying vaccine rollout by a day. Vaccinations are to begin in Guinea's capital, Conakry, today. Most of the 11,000 doses are to be taken to the southeastern town of Nzerekure. 5 people have recently died there from Ebola. It's West Africa's first outbreak of the deadly disease since 2016. To our coverage of the COVID-19 pandemic now, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says that deals between some high-income countries and manufacturers of COVID-19 vaccines are undermining its COVAX initiative by reducing the number of doses it can purchase. The WHO chief warns that the longer the virus spreads, the more opportunities there are for changes, and that could make the vaccine less effective. Currently, more vaccines are being developed and produced globally, and there will be enough vaccine for everyone in the future. But for now and for the rest of this year, vaccines will be limited resource and must be used strategically.
Currently, some high-income countries are entering contracts with vaccine manufacturers that undermine the deals that COVAX has in place and reduce the number of doses COVAX can buy. Even if we have the funds, we can only deliver vaccines to poorer countries if high-income countries cooperate in respecting the deals COVAX has done and the new deals it's doing. This is not a matter of charity. It's a matter of epidemiology. Unless we end the pandemic everywhere, we will not end it anywhere.
Now, Oman has suspended arrivals from 10 countries for 15 days to limit the spread of COVID-19. Out of the 10, 8 are African countries. They include Sudan, South Africa, Nigeria, Tanzania, Ghana, Ethiopia, Guinea, and Sierra Leone. The others are Brazil and Lebanon. The suspension will take effect from Thursday. The decision also affects arrivals from elsewhere if they have passed through any of the suspended countries in the 14 days prior to applying to enter the country. Oman's Ministry of Health earlier this month said travelers, especially those from East African countries, had accounted for 18% of new infections. Still to come on the program. Egypt commemorates frontline workers with new £1 coins. More details in a moment. Please stay with us. Welcome back to the program, and still on the COVID-19 pandemic. A survey conducted by the Nigerian Center for Disease Control and the Institute for Medical Research finds that the rates of infections from COVID-19 in the country are much higher than previously reported. The results indicate that 1 in 5 of those tested in the states of Lagos, Enugu and Nasarawa have been infected. In the largest city, Lagos, the report says as many as 4 million people that have contracted the disease, although the official toll is currently 54,000. The survey was conducted in September and October. The head of the NCDC said the results of the survey made Nigeria's vaccination efforts even more important. More than 1,800 people have died in the country from COVID-19. Health officials recently approved the Oxford AstraZeneca vaccine for use in Nigeria and is hoping to take delivery of the vaccine by the end of February. Joining us now is Dr. Seun Akinyemi, a consultant public health physician at the University College Hospital in Ibadan. For more on this, Dr. Akinyemi, thank you so much for joining us on Network Africa. So, if you can hear me, what do you make of this NCDC report that says the rates of infection from COVID-19 in the country are much higher than previously reported?
Well, I'm not surprised. I think it's to be expected. Our testing is very, very low. I think we've only tested less than 2% of the population. So it's to be expected that the reports, the reports of incidents and morbidity as well as mortality will be far less than the reality. So there are so many people that are not tested. We only test those who come to the hospital, maybe because they have symptoms. Those who are traveling, there are several other people who have the infection but are asymptomatic. There are many people in rural areas who don't have access to testing. There are many people who don't have any business traveling internationally who are not tested. So I am not surprised. I'm sure that many researchers will not be surprised that the infection will be much higher. I think what we are just seeing is the tip of the iceberg. There are many people who are asymptomatic, and we need to do more about testing. Our testing has to be systematic, has to be strategic. We need to do more so that we can get the real picture, so that we can plan and get our health system ready for to cope with this pandemic.
Well, let's talk about vaccines now. A lot of the focus is now on vaccines. By the end of this month, Nigeria hopes to receive the Oxford AstraZeneca vaccine. How should the government go about its rollout plan?
Yeah, I think the rollout plan has to be evidence-based. It has to be data-driven. First and foremost, we need to prioritize the health workers, be that they are the one at the forefront, they are the one that are most exposed. And when we do this, we are not only protecting the health workers, we are protecting ourselves. We are ensuring that the health system will not collapse. We will have people to attend to other people when they are sick. And then when we immunize, when we vaccinate health workers, we protect even patients coming to the hospital from getting these hospital-acquired infection. So first and foremost, I think all over the world, the first priority is health workers. After prioritizing health workers, the other group of people, elderly people, mostly the elderly people have more severe infections, and the mortality, the deaths have been mostly among elderly people. I think people from 65 years and above should be prioritized. They should be the first set of people, maybe some people with disabilities that make them predisposed, maybe those who are asthmatic or those who have other coexisting infection, we need to prioritize them. So, and then we need to look at our own data locally. What I said is a general, but we need to look at our own data in Nigeria. Who are those that are most affected? Who are the deaths that we have recorded? Among which age group do we have most of them? So these are the things that we use. Like I said earlier, after prioritizing health workers, we need to look at our data, prioritize elderly people and those with specific disabilities that made them susceptible to the infection. That's the way I believe we should go about the rollout plan.
All right, then, Dr. Shinwa Kiyemi, thank you so much for your thoughts on Network Africa. Now, Egypt has issued a 15 million coins bearing the slogan, Egypt's medical teams. The aim is to commemorate the country's frontline workers in their fight against the coronavirus pandemic.
Sharif Hazem, an advisor to the Minister of Finance on Engineering Affairs, says the new line of coins in Egypt includes 10 million £1 coins and 5 million PT50 coins to spread awareness. The coins are meant to be exchangeable, regularly used by citizens.
We were careful, like all other government branches, to commemorate medical staff teams. There were two ideas: either work on a gold and silver collector's edition coin or work on exchangeable coins. We realized that exchangeable coins that have symbols of medical staff, which include doctors, ER workers, nurses, and even administrative workers, would be more popular because it will be with everyone, not just enthusiasts who buy coins.
While many appreciate the newly minted coins, some believe that more should be done to support medical workers on the ground.
It is surely a great move that there is a somewhat spiritual appreciation for doctors and nurses, for the whole medical team. We of course need more. We have now reached around 400 martyred doctors who have died because of the coronavirus.
The Finance Ministry says Egypt has taken a number of steps to support the medical workers, which includes raising salaries for around 600,000 doctors and nurses at a total cost of 2.25 billion Egyptian pounds. Egypt has recorded over 175,000 cases of the coronavirus and over 10,000 deaths.
And that's the program today. Thank you so much for watching. I'm Tenyola Shoboale.